Hi, we're Nia and Mary-Anne from Seren Health Coaching. We are metabolic health coaches who are passionate about good metabolic health for everyone. We also love to chat about all things health and to share as much information as we can with people who want to make changes to their lifestyle but aren't quite sure where to start. We're going to release a new episode every Friday where we talk about a different aspect of health. So do subscribe and let us know what you think. We'd also love to know what you're interested in too. So if there's something that you'd like us to have a chat about, do send us a message and we'll do our best to cover it soon. Hello, Mary-Anne.
Hi, Nia. How are you today?
I'm good, thank you. I'm very excited about our new topic today.
Are you? Okay. So, what are we going to talk about?
So I thought today we would talk about weight loss targets.
Okay.
Um, 'Tis the season after all, but
Yep.
specifically whether or not actually having a target weight in mind is actually helpful
Yep.
when you're looking
I
to
like
improve your health.
that. Yep. So, where do we start?
Okay, so we are going to start at the very beginning.
Know that.
Sorry, I got a
I'm
bit of
not
sound of
singing, by the
music
way.
then.
You do not want me to sing.
Okay, it's very, yes. All right. Well, anyway, we're going to do that. Start at the beginning.
Okay. So, setting a target then.
Yes. So obviously, when you start to change things before you get going, usually, and I would say 90% of the time, people will
Yeah.
say, okay, I'm going to set myself a target
Yeah.
to aim for. So, where I want to go.
Okay. So, they have boxes on the Slimming Club sort of cards. I remember that, and
Yeah.
you
Yeah.
had to put a little target weight in,
You do. You
and
do.
that was quite exciting because just seeing the fact that you were going to
You're going to
lose
get to this
weight was
number.
quite
Yeah.
exciting.
Yeah, so I don't know what they do now because it's probably all digital, isn't it? But yes, you
Yeah,
get a little card. You used to get a card.
yeah,
You'd weigh in. Somebody would put you on the scales, and then they would say, "What weight do you want to be?" And then, of course, your brain goes,
yeah.
"Oh, I don't know."
Terrible question.
Yeah, and then you think, "Oh, well, what weight should I be?" And then that sort of starts off on this whole kind of, I don't know what I'm aiming for, but I need to aim for something low.
Yeah, very low.
Yes, yeah.
Yeah. Okay. So the first issue is the question, what should I be? Because I
Mm.
don't even think people necessarily ask themselves, what should I be? And that's the problem. They fantasize about what they could
Could be.
be, I
Yes.
suppose.
Yeah. So I think a lot of that then goes back to people, well, the advice that they get given is
Yes.
then, let's look at your BMI,
Yes.
let's look at your
Oh
height, and then
golly, the
let's work out.
BMI. Yeah.
We love that, don't we? Um,
Yeah.
so it's not an exact science, but somebody in this slimming club with no real additional knowledge, to be blunt, and I
Yeah.
don't mean that rudely, I just mean
No,
that
no.
that's where they've come from, says, okay, well, you're 5'3", so therefore you must weigh in between this range. And that's the other thing is this
The
massive
range.
range
Yeah, the
of
range
what
is
you can
huge.
be that's healthy. Yes. So then you have to pick from the range.
And I've never been even in the middle of the range, let me tell you, since I was probably 15. So, yes, I mean, most people are not at the bottom of that range, by the way, because they definitely wouldn't be at a slimming clinic. But
No,
um,
no.
I am not a fan, as you know, of the BMI for all sorts of reasons that we'll talk about. Yeah, it's definitely not an exact science.
Yeah, tell us a bit about the BMI. Why was the BMI, why is it used? Why are we still
Well,
using it?
it basically is an epidemiological, I love that word,
It's a great
tool.
word.
So it was a tool for looking at population. So if you
Yeah.
wanted to see a population in terms of weight, the BMI was I mean it is a population tool because it
Mm,
does give you the trends. But the trouble is if you put it into individual usage, it's not half as useful
no,
for
no.
all sorts of reasons which I'm sure you're going to explain.
Yes, you can't use it for pregnancy or people with a high muscle mass,
Or rugby
athletes.
players
Yeah.
or well, lots of people actually,
Yeah,
even
so funny enough, it's a tool that fits everybody but doesn't fit most people. It's very strange.
it's a tool that fits populations. I mean, that's as simple as
Yeah,
that.
yeah,
So it'll
yeah.
show you the trends if you look at BMI charts between 1970 and now, for instance. They make a very nice little, a curved chart.
Mm,
So I like the fact that it's an epidemiological tool, but it's pretty useless when you apply it to individuals. That's
yeah,
my take on it, I suppose.
yeah. But in the absence of something better at the time, I
Yeah,
suppose when we started, that's what we got lumped with.
we did.
Okay.
Okay, so what are you going to use instead then? What's better?
Well, yeah, that's true, isn't it? So there's a lot of debate about this.
Yeah.
Fun fact, I was thinking about this and I thought it might be interesting. There is something called the ideal body weight, right?
Oh, is there?
But this doesn't mean what you think it does, sadly.
No, I bet it doesn't.
It's used in pharmacy to calculate drug dosages depending on
Ah.
whether or not the medication you want to put someone on is soluble in fat or soluble in water.
Oh,
Because,
you see, you're full of
yeah,
it, aren't you?
sorry, just really bad. So
Random fact.
so you have to kind of look at the patient in front of you and calculate
Oh,
what the
really?
dose they should have based on their ideal body weight rather than their actual body weight. So
Oh, that's
that's a bit
interesting.
confusing.
Okay.
Yeah. And then
I
there's
didn't
a
know that.
yeah, see, fascinating. This is why
Yeah.
you hang around with me. Some ratios then that we can use and we use more frequently. So you can either use waist to hip ratio or height to waist ratio.
Okay. I mean, all these things are pretty arbitrary, really. And if you've ever measured your waist, I mean, it's
Mm.
not an exact science either, is it?
It's not. And obviously, it doesn't tell you what weight you should be. All it's telling you is how much fat
Mm,
distribution is around your
your
middle.
middle. Yeah.
So it is a good health indicator, but it doesn't help you set a target. So more reliable than scales, I would say,
Yeah.
and we'll talk more about that in a minute. It's not an exact science again, but it does give you something to work towards.
I mean, if you've got a lot of fat around your middle, there's metabolic implications, and I suppose waist measurements is slightly more useful for individuals. But
Yeah,
again, there's genetic shapes in there. There's apple shape versus pear shape. There's,
yeah, yeah,
you
yeah.
know, I
I
don't,
mean,
and people get really destroyed by these sort of exact measurements or what
yeah,
you should be.
yes, yes, absolutely, and I think that's really important to talk about too.
Mm,
So that's just one thing is, a weight target in terms of what should you be and
yeah,
asking someone as if they're an expert to tell you what you should be. So that's one
yeah,
part of it.
yeah. I
And
think,
then
yeah,
the other thing that trips people up is the unrealistic goals. So like you said at the
yes.
beginning,
Oh, yes.
yeah.
Well, it's almost universal. If somebody wants to lose weight,
Mm.
and you ask them how much they want to lose, it's such a leading question because the person starts to fantasize about what they looked like maybe when they were, I mean, a teenager and think, golly, if I could go to that weight, imagine what I'd look like.
Well, exactly. And maybe they've often, and I don't know if this happens as much anymore, but do you remember maybe in the 90s and early 2000s, there were articles in women's magazines and also in the Sunday supplements of the newspapers that would interview people and ask them how much they weighed, like celebrities and actresses. And
Mm,
there would often be some sort of written indicator of how much a certain celebrity weighed. And then you'd think, well, I
I
should
want to weigh
weigh,
that.
I should weigh what Kate Moss weighs. Well, no.
Well, completely mad.
Yeah. Completely
Yeah,
different people. And
yeah.
yeah, we're very unlikely to get back to the teenage weight, aren't
Well,
we?
exactly. And I mean, I think I'm sure that we've all been there about fantasizing about getting back, especially as you get older.
Mm,
Because
mm.
isn't it true that as you get older, the tolerances for weight are wider in terms of range?
Yeah, I think so. And that's another reason why BMI isn't great because it doesn't take
Mm,
into account your age.
mm,
And the thing is, when we get older, there are certain things that we do need to consider.
yeah.
If we are all skinny as rakes or thin as sparrows,
Mm,
if we fall over, we're going to break something.
mm,
There's no padding to
interesting.
stop that happening.
Mm,
If we don't have our balance and core stability, that's really a problem.
mm,
And that if your fracture risk is higher,
yeah.
again, that's it really awful, isn't it? Because you're gonna have to lie in a bed
Losing
recovering.
your muscle
Yeah.
mass. So what you're saying is it isn't just about weight.
No.
I mean, who knew? That health is not really about weight, but that's sort of where we've got to. We're so obsessed with
Yes.
weight because we live in a world where weight management is really challenging.
Yeah, and I think it's not been helped by the just frankly astounding number of people who will try and sell you something to lose weight. And the very first question they
Yeah.
ask is, how much do you weigh? Second question is, what do you want to weigh?
Yeah, yes. What they leave out, in my view, is why. So I've just
Mm,
read a book which talks about the five whys. So rather than saying, what would you like to weigh, the author says, just ask why five times. Because
yeah,
what it starts to clarify is exactly what the aim of that person
person
is.
is. Yeah.
It's quite interesting. So
Hmm.
if you ask yourself why, so you might say, well, yeah, but I really want to look good on the beach because, whatever. But why do you want to look good on the beach?
Because
And
you want other
it,
people to look at you, or
whatever. So
because you
it
want
sort
to
of
feel.
unpicks some of anyway, it's quite
Yeah.
interesting read. Yeah.
Interesting. Interesting. Okay.
Okay. So what I would like to ask you, I suppose, is do we need weight loss targets at all?
So I think, and this might be controversial, I don't know, but I think no.
Do you now? So I think we wouldn't have said that originally. I think
Into
we've
that.
grown about weight loss
Yeah.
targets only because of our experiences with real people
Mm.
and ourselves, probably.
Mm.
That we always had targets are good. And I can see that in some ways targets are. We're talking about somebody in a gym, say, lifting weights, for instance, and they have a
Mm.
target to lift a certain weight, and somebody gets very excited about working towards that target. So
Mm.
you can see that weight loss is very similar. People are trying to motivate themselves, and
Mm.
it's very difficult to say, actually, don't bother having targets because we're going to be all about, I don't know, health in terms of functionality or mobility
Yeah.
or
Mm.
all sorts of other factors. I think it's quite hard to get rid of the whole weight target thing.
I think it is too. And I think that maybe some people might need a little bit of help when you
Mm,
first get going.
mm,
But there are some other targets that obviously you could focus
yeah,
on.
yeah,
And remember, I think as well, for those people who have unfortunately had very, very awful experiences
yeah,
with weight,
yeah,
and gone through like one of those almost to the point of having a proper disorder with their weight,
yes.
just being asked what weight would you like to be or
It's
trying to
such a
measure their weight
triggering
is
question.
incredibly difficult for them psychologically. Yes.
Yeah, I
So
agree.
there are really helpful indicators to improve your health, feel better, and obviously still have the buzz of like getting into that pair of trousers you
Yeah,
wanted to have, but without knowing your weight, which I don't actually believe is necessary for everyday
no.
life.
I think it's pretty liberating, and we sort of know that from our own experience not to be focused on weight. And you might use weight as a monitoring tool in a sort of loose way, in terms, particularly when it comes to maintenance. But it's really only as an observation rather
Mm.
than, I don't know how often you weigh yourself.
I
I
haven't
do
weighed
weigh
myself
myself. I
since
know you probably
2021.
don't.
No,
Yeah.
2021. I haven't weighed myself.
Okay, you haven't weighed yourself. That's interesting. So I do weigh myself quite regularly, but more as sort of slight observation rather than in any sort of obsessed way. So
Mm.
this is the difference. I have no target. I'm just interested. And I quite like and have learned quite a lot about the ups and downs of
So
weight, which
you're sort of looking at it in terms of like a scientific study almost, like,
really, I'm quite
yeah,
interested, and I remember getting very interested when I realized it when I first attempted some weight loss a long time back. When I went out for a night out, that I put on sort of 2 kilos overnight, which was absolutely
yeah.
terrifyingly riveting until
Mm.
I realized the science behind all that. And of course, it's not
Yeah,
about
and
fat.
it's the same with your menstrual cycle. I mean,
Yes, all that.
when you
Yeah, yeah,
menstruate,
yeah,
you can put on 6 pounds of water.
yeah.
So, yeah, and yes, so weighing isn't necessarily the best thing ever, and I
No.
think ultimately this other problem is that people, you said really clearly, people might have a target at the gym where they want to lift more weight, and in a way that is similar, but in a way it's totally different because there is
Yes.
nothing stopping you from gaining the strength to lift more weight. If you put the
Yes.
practice in every
Yes.
week,
And you
you
might
will
gain more than your target
be
to
able to
move
lift
that
more weight.
target.
Yeah, and
Yeah.
surprise yourself with your strength. And
Yeah.
part of it is to do with your body's ability to lift that weight, and part of it is psychologically in your mindset. But the
Yeah.
funny thing about your weight when you measure it is that it's not linear, and there are so many fluctuations,
Yes.
like you've just said, in terms of daily
Yeah.
fluctuations, cycle fluctuations, what you ate the night
Yes.
before. And so if you do have this target hanging over your head, then you weigh
Yeah.
yourself a lot and your body doesn't do what you think it should do.
Yeah,
That's
absolutely.
not,
And you have periods where you plateau even when
of
you're
course.
trying to restrict and lose weight. We've done all this ourselves.
Yeah,
And the problem is having tight targets can be really demotivating. Isn't that what we're
exactly.
saying?
So basically, you then just go, well, it doesn't really matter what I do.
Yeah.
My weight's going up anyway,
Yeah.
even
Yeah.
though I'm
Yeah.
eating
So I'll
healthily
just
and
eat whatever
exercise.
I like. Yeah.
So I'll just give up. Yeah, absolutely.
Yeah.
So I think that is my major problem with a
Okay.
weight loss target
Yeah.
is that sometimes there's just too much going on to really be able to use it as a proper
Two.
validated tool.
The other thing maybe that's important to note, we talk about weight, but actually what we're talking about is fat. So
Yes. Yeah.
there's a huge difference here between fat loss and weight loss. And
Mm,
unfortunately, we're completely obsessed with weight because it's the measurable tool we have.
tool. Yeah.
So if you've ever tried, I don't know, these fancy scales that measure your fat loss,
Mm,
it's much less accurate because they, work in various ways, but mostly with currents and water and hydration. And really, if you're very hydrated, you'll get a different, yeah. So
yeah.
I
There's
think
so
the
much more
trouble
going on
is
there.
we're obsessed with scales, which are actually measuring the wrong
Well, you're
thing.
weighing everything else. You're weighing your bones, you're weighing your muscles, you're
Everything.
weighing what you had for lunch,
You're weighing how much fluid you've got on board. So
Exactly.
actually, if you want to dehydrate yourself overnight, it's quite fun because you can weigh less in the morning.
Way less in the morning after
I
you've been to a
mean,
toilet. Yeah,
we've
absolutely.
been there, got all this. Yeah,
Yeah. So, there's just too much onto
yeah.
that. So
Okay.
this is probably where I'm coming from in terms of
Yeah,
if you want to improve your health,
yeah.
I think throw the weight loss target out of the window.
Okay,
It's not going to give you a reasonable, validated, accurate representation of what you want to achieve. And body measurements are much more accurate because
okay.
there will be times when you are on a weight loss journey, for example, and people who are trying to improve their health. And I see this in diabetic patients all the time, where they have lost a great deal of weight.
Yeah,
Now they are refocusing on a healthy lifestyle and putting in some foods that they may have stopped eating for a while, right? But they're also now exercising more and in different ways. They might be building muscle mass
yeah.
and focusing
People
more on that.
love that.
Yeah,
If you ever tell people that their weight gain is muscle
they
gain,
love it.
people get terribly excited, but I'm always a little bit cynical myself
But
about how
it's
much you can actually
actually
gain
gain,
in
yeah.
muscle. But there you go. I'm a
But
cynic,
say
as
that
you know.
everything sort of evens out and they
Yeah.
do build some muscle and
Oh,
their
I'm
muscle
sure.
to fat ratio is better,
Yeah. It's the
then
ratio.
yeah,
Yeah.
then the ratio, then their body shape will reflect that. So if you are doing exercises that
Yeah.
improve your muscle, your core will change, your abdomen might change shape and your hips. So therefore your measurements become much more important than what
Yes.
the scale says.
Yes. Have
Um
you ever consistently measured though? I mean, it's not half as exciting as standing on that little thing in the morning, is it? To measure. This is the problem with
this is the
I
problem. It's
love
not
I
it's
love
not
the
exciting.
science. I love the science behind measurements, but to be honest, I never seem to get the tape in the right place or the same place, and I'm sort of cynical about how often people would use that as a motivational tool.
So
I
this is where I come in terms of which one you choose to use, waist to
Yeah.
hip or height to waist.
Yeah.
And I think the easiest one is height to waist because you only have to measure your height once unless you're
Yeah.
shrinking
So you're just
dramatically.
measuring your
So you're
waist.
just measuring your waist.
Just not as exciting, is
It's
it?
not
It's
as
not
would
got
you
the
like me
ding
to come
dong.
and stand there with a party popper every
It
time
hasn't got the ding dong digital thing. I mean, that's maybe what we should design is a digital waist measurer.
that goes da 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 da
Yeah.
da. You are
Yeah,
two
that.
inches smaller than last time you measured. Yeah, no,
Yes,
okay.
that. I mean, you can even tighten it.
Indeed, indeed. Okay, well,
I've
I'll
been there.
patent that for our millionaire pitch on Dragon's Den. Okay.
Okay.
But yeah, ultimately, I think that's probably the easiest one. And if you look at it in terms of instead of a weekly weight you change it to a monthly measurement. Oh, look, I did alliteration there by total accident. You actually can see progress
Yeah.
better. Um,
I think it's sort of my own weight loss journey, if you want to call it that. I really hate the term, but
I know.
um
Can't think of anything better though.
my health journey. I
Still
think
don't have a
I
journey.
feel good in my clothes is probably my best thing.
Yeah.
So if my jeans feel good
Yeah.
and comfortable around my waist, if they get tighter, I don't like it. I
Mm.
think, to be honest, That's more motivating for me and a better measurement overall. But I think you have to find your thing that works for you.
Absolutely. You find the thing that works for you. And the reason that we like the measurements that do your waist is because it is such a good indicator
Yeah,
of metabolic disease. So,
exactly. It's
you know,
where
the
the
beer,
fat is you don't want.
yeah,
Yeah,
it's where your, your spare tire is,
yeah,
your beer belly.
yeah.
Think of all the things you've got in that area, your pancreas, your liver, your heart. You don't want
Mm,
excess fat around those organs. So that's where you
mm.
need to realize that
And I
that's
mean, a
the
lot of
higher risk.
people don't even know the difference between subcutaneous fat and visceral fat, as we call it. Love the name.
Mm.
If you ask people what visceral fat is, lots of people wouldn't know. But visceral fat's the thing you're really interested in losing. The rest, subcutaneous fats, actually keeps you warm and has probably a few advantages. But
And obviously we haven't even touched on those people who, we all know those people who are as thin as
yeah,
anything, can eat what they want seemingly,
yeah,
but actually is
yeah,
it
have
just that
more
they're not
visceral
good at
fat.
putting on subcutaneous fat, but they're stuffed full of visceral fat inside that you can't see?
And we
Yeah.
all know because we've looked after them as health professionals that, not all type 2 diabetic patients, by the
Are
way,
massive.
are overweight. So there
Mm,
you go. So that's always a sobering sort of lesson.
absolutely. So I think that overall, my major sort of takeaway from this
Yeah.
is, don't panic too much about the
Yeah.
scales. Find something better to focus on. If it's not measuring, with the tape every time, that's fine. Pick your favorite pair of jeans and try them on every month. And then look at your progress, because I promise you, since 2021, nobody has asked me how much I weigh.
How much do you weigh?
Okay, you've ruined my streak now. But ultimately, nobody's
I'm not
needed to
I'm
know.
interested now. Yeah.
Nobody's needed to know. Like,
No.
nobody walks down the street and goes, "Nia is
Do you
XYZ."
think do you think that's because you got obsessed with weight as a marker? I mean, I think the difference is I weigh myself because 'cause I'm not obsessed.
Maybe, I don't know. I
No,
think the
it's
difference is because
personality maybe. Mm.
originally, both of us have been to slimming clubs and all the rest of it.
Yeah, yeah, sure.
But the last time I went to a slimming club, as it were, when I actually really did make changes that really did change my life,
Yeah,
I didn't actually do a plan that
okay.
was sold by the place that I was going to. I did she was very different to a lot of slimming clubs anyway. It
Mm,
wasn't like it, she didn't have a plan by a multinational corporation, but what she
yeah,
did do was an amazing exercise class.
okay. So
So she would
more
do a
health
weigh-in, she'd give you a little
orientated.
talk, and
Yeah,
then you would do some exercise, and it would be a mix of cardiovascular exercise, but the majority of it was strength training. And that's when I
okay.
had much more of an idea about metabolic health and about
Yeah,
muscle mass.
yeah,
So I did have a weight target when I started that, and again, it was, and you will be absolutely shocked to know it was what I weighed when I was a teenager. Funnily enough,
yeah. No, I'm not
um,
I'm not that shocked. I mean, you're quite young.
yes, I know, but actually, I ended up surpassing that in the
Yeah.
end because I looked at my metabolic health and not just as the weight on a
Yeah, and
scale.
that's sort of what we're trying to get at. But I still think that motivation is part of the story, and the trouble
Yeah.
is that it's the easiest sort of factor that
Mm.
people get to look at,
But I think, yeah, so I agree with
and
that
the wrong one.
entirely. But I think that they are too demotivating. They can
Yeah,
lead to real obsession,
yeah.
and
For
negative
most
thoughts
people,
associated with the changes that you're making that don't need to
yeah,
be there. So, you know, I think,
yeah,
throw it away, throw the scales away. No one's interested. If you're trying to improve your lifestyle, pick a pair of trousers that you want to feel better in and use that as your indicator to start with. And then if you get down to those trousers, pick another pair, you know?
yeah. I wouldn't completely throw the scales out, but I think you're absolutely right. You're measuring in a way, you're measuring the wrong thing.
Mm,
And they're actually very motivating when you first start to lose weight. But the
yeah,
trouble is they get less and less motivating
yeah,
when you've lost weight and you're trying to maintain some sort of weight loss. This
mm,
is where, for me, the real problem comes because
comes,
they can
yeah.
be really demotivating when you're starting to bob on those scales.
And isn't it
So,
interesting how everybody can tell you, oh, when I did really well and I weighed
mm,
XYZ, you
yes.
know?
Yes, I mean, you can see that. If
Yeah.
you jump on scales every day and you're restricting your intake and you're doing more exercise, and those scales correspondingly start to drop. So
Mm.
even if you're pretty balanced and you're looking at trends, the trend eventually has to stop
Yeah,
because
otherwise you wouldn't be
otherwise
anyone.
you wouldn't be alive. So at some point, you'll plateau. You'll even plateau long before you want to plateau, by the
Of
way,
course.
as
Of
we all
course you will.
know. And there comes the problem because these scales that were very motivating now become a seriously demotivating tool.
Yeah.
And this is the problem. And I think for people like me who are lucky enough to have managed my weight and manage it fairly well day to day now, don't think about it. The scales aren't a big thing, but I still look at them for fun in a sort of mildly interested way. I
But
think
for
that's a very
me,
different take to
yeah, I think
becoming demotivated by scales.
I think if I weighed every day and saw the normal fluctuation, because
Okay.
I know
You
that my
wouldn't
weight
like it.
fluctuates with my cycle and everything
Yeah,
else,
yeah.
I think that would lead me to be quite sad.
Okay, well there you go. And that's what we are really all about at Serene Health Coaching is finding what works for you and really
Mm.
trying to help individuals to use tools that are helpful for them. So
Yeah.
it might be that you and I have slightly different takes, and that's for all sorts of good reasons. But neither
Yeah.
of us are obsessed with scales per se, but
No.
we have maybe a different take on whether we
Whether
would
they're
weigh ourselves
helpful
at
or not.
all. And you've taken the line of it not being useful for you, and I
Yeah, and
would
I mean, there are
say,
some people that I work with who say they're very helpful, and that's
yeah,
fine.
yeah,
But we always discuss measurements too,
yeah.
because I know there will always become a time, as you said, when the plateau will happen, regardless of whether
Oh,
you want it to or
absolutely,
not.
absolutely.
Cool. Okay. Yes. So, shall we see you next week?
See you next week.
Take care.
Bye for now.